Hello, and welcome to the Iowa Beef Center Winter Cow webinar series. Tonight we're going to talk some about calving season preparation. We will hear from Dr. Grant Dewell, our extension veterinarian. He's going to talk about calving season prep and dealing with Dystocia. And we'll also hear from Chris Clark. He is the South Central Iowa State Extension beef specialist, and he's going to talk some about managing that newborn calf and neonatal management. So I'll hand it over to Grant.
Thank you for joining us for this webinar on getting ready for the calving season. We'll be discussing some of the things that we can do to make sure that your cows and your facilities are ready as we approach that oncoming calving season. A couple of resources that might be valuable for you. Most of the stuff I'm going to talk about here is available on the Iowa Beef Center webpage under our calving management manual. If you go to the iowabeefcenter.org, click on the production menu, go down to cow-calf operations, and then you can find the calving management manual here online. Again, most of the stuff I'm going to talk about here is available in this online manual, and it's a good resource for lots of different things that may be of useful. Another good resource is our calving book. It's available from your beef extension specialist. Any data you record on your calves, your breeding history on your cows, etc. So that'd be a good resource for you. Some of the things that were important to look at and why we need to get ready for the calving season now is when we look at some of the reasons of why we lose calves. This is some old data out of Colorado. But you see that the biggest death loss of calves was from what they call reproductive losses, which basically that accounts for calves that were lost due to either late-term abortions or stillborn at birth or died shortly after birth, probably due to calving difficulty. So you can see about a third of our death loss is associated with calf not being able to function or transition from being in utero to being alive on the ground. And if we look at some of the other causes of death loss, the enteric is most likely due to calf scours, which again, as Chris Clark is going to talk about, calves that don't get colostrum, probably because some of those were Dystocia calves, are most at risk of getting calf scours. And so we can add a lot of these other diseases, enteric and respiratory disease, as well as some of the other unknown losses that may have been found in snow, etc., onto the fact that that calf just didn't adjust getting born. Okay. Some of the risk factors when we talk about reasons for calf death loss, one of the biggest ones is calving early in the year, typically before April 1st, which is when we're more likely to have some adverse weather conditions, whether that's a snowstorm or a blizzard or just cold, wet weather that can really make it hard for that calf to adjust. So even as we get into March, when it starts to warm up, we a lot of times have some mud issues. That cold mud ground can really take the energy out of a calf in a hurry. So any of those things where we're not able to calve in warm green grass, it makes it harder for those calves to transition. Another big cause of death loss in calves is the increased number of heifers in your herd. And this is due to several things. One is as heifers are more likely to have dystocia problems, those calves are going to have increased chances of being born dead or having issues from that calving, difficult calving. Failure passive transfer. Heifers are, again, because of dystocia, those calves are more at risk for not getting up and nursing right away. Heifers have lower quality colostrum. They're not as good as mothers, and all sorts of things add into the fact that that calf didn't get colostrum like it should have, as Chris is going to talk about later. This risk goes up if we're calving our heifers with our cows, because those calves are going to be exposed to whatever that rest of the cow herd has. So that's one of the reasons why we recommend calving your heifers prior to your cows. It lets them have more time to get rebred, but also it protects those calves born to those heifer cows. Another risk factor, in these last two risk factors, I think one thing that we see is that as we increase that calving season, we have more death loss. And a lot of that is because we are as we go through that calving season, we build up pathogens in the environment. And so those calves born later in the calving season are exposed to everything, because the calves that are born early have less exposure to survive that. So as Chris is going to talk about some issues to deal with that and decrease that contamination. But so ideally, we'd like to see a 60-day breeding season. Your calving season will be slightly longer, but narrowing that down as much as possible. Kind of similar to that is the maintenance of that calving area. So again, if we're calving in March, it's a little, maybe still a little cold, but we're also dealing with a lot of mud in some cases. And if we got high animal density, mud, those types of things, and then we're just increasing the chances for that calf to be exposed to some of those pathogens, as well as get cold from that being down in the mud, etc. So all those things add up to increased chances for calf death loss. One issue that sometimes we talk about is what we call the weak calf syndrome, and we see this every year, but on some years we have more of a problem that's due to a poor nutrition issue that we're dealing with. But generally, weak calf syndrome is a pretty nondescript term. Basically, just calves are weak and don't thrive well. Most of them are born alive, but they really lack that vigor to get up and nurse, and most of those are going to die. You can, with some really intensive management, keep them alive, but in a lot of cases, that is pretty hard to do. So, weak calf syndrome again is sometimes difficult to diagnose, because a lot of times it's hard to figure out what that inciting cause was, because it may have happened 1 or 2 months ago before that calf was even born, and now we're dealing with a calf that's weak and sometimes hard to explain what happened. But typically, some of the primary causes that we see associated with weak calf syndrome, if we look on general diagnostic lab results, dystocia is one of the biggest causes. So even unrecognized dystocia, so calf that was born unassisted and is found weak the next day, a lot of times on those diagnostic workups on those, we find evidence of dystocia, typically due to hypoxia in the brain, that we can identify that there is dystocia. So even because the calf was unassisted doesn't mean that calf didn't suffer from dystocia during that birthing process. Nutritional problems during gestation we'll talk about a little bit, but that's, again, typically in those poor nutrition years, some of those issues that we deal with, along with some vitamin and mineral deficiencies. Weather, particularly if we have a really cold weather, sometimes that can add on to that. Probably trying to get that because we're not meeting our nutritional needs due to the cold weather. And then occasionally an infectious disease like BVD virus or something like that can cause some weak calf syndrome. But again, besides dystocia, nutrition is going to be the key. And if we think about it, about 75% of that fetal growth occurs in that last trimester, in those last 3 months. And so that's when that calf is really starting to grow, as well as the nervous function. So when you have a calf that doesn't seem to have the suckle reflex, some of that may be due to they don't have that nervous function, or they don't have the nervous function to stand and nurse, because of some deficiencies in nutrition as that calf was developing. Typically, again, on these poor nutrition years, it's typically because we've got poor quality forage. That can be kind of a problem. So one of our biggest years that we had for weak calf syndrome was in 2013, following the 2012 drought. We just had very poor quality forage across there, kind of compounded that with a severe winter that time, weak calf issues. That's important. Why it's important to monitor that body condition score as we go through the winter and late gestation, making sure that we're providing those nutritional needs for that cow, so that she can support that growing calf. Energy is the big key. Typically, if we're going to have a nutritional deficiency, it's probably going to be energy. Again, that calf has to get that brown fat deposited in order to survive when it's first born. Typically, a rule of thumb is about 11 megacalories per day, but we really need to account for environment. So if that cow if it's below zero, she's really facing some cold stress, and so we need to bump that energy intake up a little bit for her to count, so that she's not losing weight while she's trying to grow that calf. If we look at this study from Dr. Cora down at Kansas State, looked at depriving cows of energy in the last trimester of that gestation, And you see here that these cows at a low energy diet lost 2 pounds. That's about 2 body condition scores that those cows lost. So down to body condition score 4 during that process. And you can see that the calf survivability on these was down to about 70% of calves actually survived, and a lot more death loss from calf scours, etc. If you compare that to these other group of cows, which were on that same low energy diet for the first 70 days, but then the last 30 days, they tried to put the weight back on them. So they fed them a high energy diet for that last 30 days, almost put the weight back on these cows. They only lost about 20 pounds. But if you look at the differences in that calf survivability, 100% of these calves survived after birth. So you can see what the impact of that low energy diet has on that calf in that last gestational time frame. So again, important to make sure we're meeting those energy needs of those cows late into gestation. Protein is another issue. We see that protein is directly related to calf vigor and thermal heat production after born, as well as time to stand. So those are all important as far as that calf being able to get up and nurse. Generally recommend about 2 pounds of protein per day. In most cases, we're meeting our protein requirements. We usually feed enough supplements that we're getting our protein requirements. So energy is the main concern, but when you're balancing your rations, make sure your protein is where it needs to be in most cases. If we look back at some of the early work on the weak calf syndrome up in the Northwest, up in Idaho was where it was first described back in the 1970s. And they had a pretty direct relationship between crude protein. This graph is kind of backwards, but crude protein here at 2 pounds per day, they saw 0 cases of weak calf syndrome. And as protein went back to 1.5 to 1 pound per day, that important part of making sure we're meeting those protein requirements. The last major nutrition thing we talk about is the vitamins, particularly vitamin A and E. Those are both vitamins important for muscle function and nervous function, as well as after that calf is born, that immune system function, making sure that calf is. When we look at again, some of this weak calf data from 2013, calves that were submitted after the 2012 drought for weak calf syndrome, we see that the average vitamin A in these weak calves was about 3, when the normal should be at least 12. And so even the maximum calf that we saw barely made that normal range. Very similar for that vitamin E. So the importance of making sure we're meeting those vitamin A and E requirements and getting that calf able to thrive. So generally, we recommend that the vitamin A be about 30 to 45,000 international units of vitamin A per day. You can see that poor quality hay only has about 600 international units. That's of carotene, which is then converted to vitamin A, and corn stalks has essentially 0. So if we're feeding some of these poor quality forages, then we need to make sure we're supplementing that vitamin A in some other fashion, either the mineral supplement or an injectable product. Vitamin E, similarly, 300 to 500 international units. And basically, if it's not green growing grass, vitamin E goes away very fast. So probably need to supplement some vitamin E. One of the other things that we saw, particularly last year, were an increased number of what we call dwarf calves, which is typically associated with manganese deficiency. These calves have enlarged joints and very short legs, about 35% shorter legs than a standard calf would have, and they have somewhat of that dome bulldog. Typically, again, this was probably due to some poor quality feed due to the issues we had growing season of 2018, getting good quality hay. And so again, we may have that issue this year as well. Other thing that we typically noticed on these herds that had this dwarf calf problem is they were feeding either a free choice mineral or were not supplementing minerals at all. And it's important, I think, again, making sure we're meeting those mineral requirements. And if we're supplementing any type of feed, probably try to get that mineral included in the feed and not allow that free choice, because some of these supplemented feeds have enough salt that they may not then go and consume enough of the mineral to meet their trace mineral needs. So make sure you're getting your mineral mix into your supplement, not relying on that free choice in the wintertime. What we really want to do once we get that normal calf born, is then we want to make sure that that calf then has the ability to consume colostrum and then thrive. So again, part of that calf syndrome with dystocia is that these calves don't get up and nurse right away from that. So we want to make sure that they have that ability to stand and nurse. So that basically, when we talk about maternal immunity, we're talking about the passive transfer of antibodies from the cow via the colostrum in order to provide that immune function for that calf for the first part of its life. And again, Chris Clark is going to talk a little bit more about how we make sure we get that calf to consume colostrum and supplement, etc. But if we want to provide this quality colostrum, we need to make sure we're, again, preparing that cow to make colostrum. And so if we look at what's in colostrum, this is from the dairy cows. See here, and that what they call that first milking is what we would call colostrum. And then as that cow transitions after about the fourth time she's milked. So if we look at the differences between colostrum and milk, we see that high level of protein, which is basically antibodies, the IgG antibodies that cow is concentrating in that colostrum, and that's what provides that. Also, you see that we got a little higher fat, a little bit more minerals and vitamins in colostrum compared to regular milk, making that important. Again, this is dairy numbers. So typically a dairy cow, if it's above 50 milligrams per mil of IgG, it's considered good quality colostrum. So the average dairy colostrum is around that 50 level. Good beef cow colostrum is above 100. So if the difference between beef cow and dairy cow is beef cow is about twice as concentrated as dairy colostrum if you're having to supplement that. So again, we look at the ability for that cow to produce good colostrum. Again, that nutrition status of that cow is important in getting colostrum made. We see here some of the across the top here, we have body condition score from a 2 up to a 6. Clark is going to talk about some of this later as far as that ability for that calf to actually stand and nurse. But if we look at the amount of colostrum that cow was able to produce, down here at the bottom, body condition score 2 only produced 750 mils of colostrum versus the body condition score 5 produced almost twice as much colostrum. They didn't look at the concentration of antibodies, but between the time to stand, the volume of colostrum, and probably the quality of how many antibodies were actually in there, you see that the calf actually gets a lot more IgG from these higher body condition score cows. So we want to make sure that, again, that nutrition is important for a cow's ability to make colostrum. If you want to target some specific antibodies, if we look at how colostrum is made, basically about 6 weeks prior to calving, that udder starts to develop. As that develops, the mammary gland starts pulling antibodies out of the blood circulation and concentrating it into colostrum. And that peaks about 2 to 3 weeks prior to calving. So if you really want good quality colostrum, we want to make sure that our antibody levels are peaking about 2 to 3 weeks prior to calving. And so it takes about 2 weeks for a cow to respond from a vaccination. So if we're going to try to focus on a calf scours vaccine or some other vaccine, we want to give that vaccine about a month prior to calving so that the cow has 2 weeks to respond. And then right when that 2 week window is opening up there prior to calving, when that colostrum is actually getting made at the highest level. So if you're looking at doing that, again, about a month before calving, this graph just kind of displays that. We can see again here, we give an injection here of a vaccine, and about 2 weeks later here with the IgG is when that peaks. That's the first time that animal has seen that vaccine. If we booster that vaccine either in a couple of weeks, or if this is a mature cow and we're just giving an annual booster, then we see in about 2 weeks later that IgG level gets really high. We want to match that to when that colostrum is getting formed. Okay, if you've got a long calving season, if we were able to follow this tail out here, you would see that if we went 60 days out past when that cow was vaccinated here, then these antibody levels would fall back down into this range, and it would probably benefit to rebooster those cows that are calving later in the calving season, or separate your cows into an early and a late group and only vaccinate them about a month prior to calving in both groups, because particularly those calves born later in the calving season are more likely to get sick, and those are the cows that may not be producing quite as good a colostrum because that vaccine quality has tailed off there. So it may benefit in a longer calving season to give a second booster of that for those later calving cows. That kind of covers getting that cow itself ready for that calving season. The other thing we want to do is make sure that our facilities are in good shape. Facility here, we got nice fresh bedding down in this barn. The cows can get out of the environment if they need to, if we've got a storm. So these calves have a nice environment, and we're going to control some of those pathogens, et cetera. So making sure our calving area is ready to go, it's cleaned out, we've got bedding available. Our head gate works. We don't want to remember at 2 o'clock in the morning that cable that broke last year, we still haven't got replaced yet on that head gate. So making sure those work, make sure the lights work, and we're not trying to do something in the dark some night. So all those things, just getting your facilities ready. Make sure you have all your supplies on hand, your chains and handles, plenty of lube, your calf puller, disinfectant, etc. Make sure those are all cleaned, they're maintained in good condition. So now that we're ready to start calving, we're going to need to look at making sure that we're going to then assist that cow in making that transition from a late pregnant cow to being a lactating cow with the calf by her side, and so we want to make sure that we observe that cow on a regular basis, provide assistance when we can, and then provide good care for that calf. So again, as I mentioned early on about the weak calves, a lot of those calves are dystocia calves, even if it's unrecognized dystocia, just because the calf was born unassisted, but actually had some dystocia issues. And if we look at some of the USDA data, about 60% or so of our cow-calf producers only observe their female cows about once or twice a day during calving season. So there's a lot of opportunity for those cows to be unobserved, have some dystocia issues, and not be addressed in a timely manner, and then we end up with some problems. So a lot rather have it up here in this 5-10 observations a day, making sure that we got good observation on those cows in getting that done. So maybe that means using some cameras. We talked about our facilities, getting some cameras up so that we can observe them on a more frequent basis when it's not easy to do. Those types of things can improve that. Another thing that we can do to kind of increase our ability to observe cows is the time when we feed them. So the conical calving method was developed by a Canada that basically was feeding his cows at about midday and late in the evening, and showed that by doing that, 80% of his cows then calved in the daylight hours from 7 a.m. to 7 p.m. During that time frame. So some follow-up research that was done here at Iowa State and down at Kansas State that showed that if we feed them just once at dusk, so around that 4 or 5 o'clock time frame, then that can, again, about most of those cows will then calve in the daylight hours the next day or so. So definitely some advantage there if you don't want to be getting up all night and trying to observe cows in the dark, that just changing our feeding times, and probably better switch to that if you're feeding twice a day now, at least 2 to 4 weeks prior to calving, switch over to that either once a day or that late, conical method of feeding them to transition those cows into that different time frame. So otherwise, if we don't do it, then actually most of the cows tend to calve. 60% of them are actually calve at night or more if we feed them twice a day, early in the morning and in the evening. So what we want to do when we're observing these cows is trying to identify the stage of parturition that these cows are going to, and then providing assistance if necessary. So the stages that we talk about, stage 1 through 3, stage 1 is when that birthing process starts, when that calf sends the signal to the cow for parturition to begin. That uterus starts to have some muscular contractions in that uterus as it tries to move that calf from down deep in the abdomen up to present it to the cervix. During that time frame, the cervix is starting to dilate, and that calf is being presented. So typically, this takes about 2 to 6 hours. For mature cows, it's about 2 hours. For a first-time heifer, it may go 6 to 8 hours, even up to 12 hours in some cases, as that uterus gets in position. So typically, what we see during this time frame is that cow becomes somewhat restless. She may kick at her belly some. She's basically feeling the cramping from those muscular contractions in her uterus. She'll typically isolate herself from the herd as she's looking for a place to deliver that calf. You may see a vaginal discharge, but in a lot of cases we miss that, and the water bag may start to be visible as we get to the end of that stage 1 labor. So once that fetus enters the birth canal, that cervix gets fully dilated, and that fetus enters the birth canal, then we enter what we call stage 2 labor. This is primarily marked by that forceful contractions. We've got the cow having abdominal press. We really don't see the uterine contractions in stage 1, but in stage 2, we've got the forceful abdominal press as that cow is actively trying to expel this calf. Once that fetus moves into the birth canal, typically the water sac is visible. It typically ruptures during this time frame, and then the calf should be delivered shortly thereafter. Typically, the stage 2 is a lot shorter than stage 1. A mature cow, again, typically an hour or sometimes even less. A heifer may take up to 3 to 4 hours as she has a little more difficulty getting that calf delivered. And then in stage 3 labor, once that calf is delivered, then we'll have the placenta delivered, and that typically happens within 8 to 12 hours. So what can we do as we try to manage dystocia? Again, the first thing we want to do is observe those cows on a regular basis so that we can and identify that. Typically, we see more dystocia problems in our heifer. That's because these heifers are still growing. Their pelvis isn't as big as a mature cow. So even if they're delivering a smaller calf, they've got a lot smaller pelvis too. So we typically see more problems in heifers and cows. There's definitely some breed variations. If you're comparing a large frame Charolais or to a small Angus or something like that, we're definitely going to see those changes in that body birth weight and frame size of those more larger framed animals. And typically we see that male calves tend to have more dystocia problems than heifer calves, just because of the build and the extra birth weight of those bull calves compared to their heifer calves. So have a little more issues with them. So the biggest calving difficulty that we see is typically our oversized calf. So a calf that's a little bit too large, sometimes a lot too large to fit through that pelvis easily. That's the biggest cause of dystocia. An abnormal presentation, whether that's a leg back or a backwards calf or those types of things can happen, or twins. But generally it's at a lot lower level. And then occasionally some sort of problem with the cow itself that's causing her to have some difficulty. But that oversized calf is the biggest thing. When we talk about, again, some of my rules of thumb for when to provide assistance, and again, it's important why we know what stage this cow's in. So if she's been in stage 1 labor for more than 8 hours, then we probably need to figure out what's going on. So typically what I see is somebody says, well, I thought she was going to calve yesterday, and then she never did, and now we've got a calf that's dead. Once that uterus starts to contract, the placenta starts to separate, and so if that happened yesterday, then that calf has basically ran out of oxygen. So if the cow looks like she's starting to calve, and never completes that, then we need to get that cow in and at least see what's going on. If the cervix is closed and she's not doing anything, then it may just have been some cramping or something like that. But if that cervix is starting to dilate, then we know that cow moved into stage 1. Now we need to do something else. If kind of that transition from stage 1 to stage 2, if the water bag's been out for an hour or two, but she's not pushing, then that calf hasn't been presented properly, and we need to see why. Probably the biggest thing is actually that the cow's been in labor for a while and not making progress. So typically I like to see that cow making progress at least every 30 to 60 minutes, steady progress of she went into labor, we saw the water bag, we saw feet, we saw the nose, we saw the head, and she's generally making progress. If we've been we saw the feet, but we haven't seen the nose yet for the last half hour, then I'm thinking that maybe we have some issues and we need to at least take a feel and see what's going on. If the cow ever gets tired, if she stops that birthing process or the calf looks stressed, we've got some meconium staining or those types of things, then again, we need to provide some assistance. If we see evidence that there's some sort of an abnormal presentation, we just have one foot, we've got the dew claws up, indicating probably a backwards calf, those types of things, then we want to provide assistance. One of the rules of thumb I use to determine if I can actually pull that calf is whether or not how much of that calf I can get out. So if I can get the calf's fetlocks out about a hand's breadth or about 4 inches, and that calf's nose is just beginning to be visible at that vaginal opening, then I'm pretty confident that I can pull the calf. So if I can get the fetlocks out 4 inches, that means that calf's shoulders are in the cow's pelvis. If I can do that fairly easily, then I can probably get the rest of that calf to pull out fairly easily. If I've had a struggle to get the shoulders in there, and I know my hips are coming behind my shoulders, and my hips are typically bigger than my shoulders, then I'm probably going to decide that I probably better do a C-section because I'm probably going to have an issue there. If it's a backwards calf and I can get the hocks exteriorized, then that means that calf's pelvis is in the cow's pelvis, and then we should be, that's the largest part, and so if we can do that, we should be able to get the rest of the calf out by pulling it that way as well. So other thing we need to do, we need to be clean. Okay, we don't want to introduce any contamination into that. That should be a clean environment. Prior to when that cervix opened, it was sterile. And so we want to be clean, make sure we've got good restraint so we don't have a problem with that cow getting up and getting away on us. The other thing is make sure we provide lots of lube. Lots of lube is cheaper than a broken leg or those types of things because we didn't provide enough lubrication on that. Typically, I like to use when I use my chains, put 2 loops on there, one up above the fetlock and one down below, just to try to spread that pressure out over multiple points, so I'm less likely to cause any damage at one particular place if I use that 2-loop system. So once you're providing assistance, just like when you're washing that cow, if you're not making good progress, particularly in about half an hour, then you may need to get some further assistance doing that. Or if you just can't find out what you can't feel, don't understand what you're feeling, so you can't find the other leg, or determine what part of the calf is being exposed, there may be some issues there. So if you don't know that or you're not making good progress, then you should probably provide some assistance. Generally, I recommend that basically the force you should apply is about 500 pounds, or what basically 2 strong men can apply. That doesn't mean you can't use a calf jack. A calf jack, we can put 1,000, 1,500 pounds of pressure on very easily, particularly if we're using that as a fulcrum there. But I don't want to provide that all the time. I want to use that intermittently. When the cow's pushing, I can pull a lot harder. But when she relaxes, I need to relax that calf jack as well, and not provide that severe tension that whole time frame. Because when I've got that calf under tension, then that calf can't breathe. So once that calf's head's out, it can kind of try to breathe a little bit. But if I've got 1,000 pounds of tension on that calf jack, then that calf is stretched so much that the calf can't breathe, and so we can even get into some issues with that. So when that cow stops and rests, that's when you want to kind of let off on your calf jack just a little bit and let the calf rest as well. So typical normal presentation, and actually the calf spends most of its time frame upside down during most of gestation, and about a month or so prior to being born, that calf has to flip itself up over and position itself so that most of our backwards or breech calves are cases where the calf didn't flip itself over like it was supposed to late in that gestational time frame. So if this is your presentation, then we should be able to provide some. If it's just a large calf, get that calf pulled through that pelvis. On a if it's a cow that didn't go through stage 1 labor very well, that vaginal vault may not be relaxed quite enough, and so you may take a little time and put some pressure on there to relax that soft tissue area, and that may speed up your ability to actually pull that calf once you start pulling. As I'm typically pulling the calves, again, the shoulders come through and then the hips come through. And if we look at how those hips are presented to each other, if we just pull that calf straight out, then the calf is typically widest across the hips, while the cow is narrowest across the pelvis. And so, particularly if I've got a larger calf that I'm trying to pull, I want to try to rotate that calf as I pull that and tip that pelvis a little bit so that I get increased area that I can pull that pelvis, the calf's hips. So typically what I do, if it's in most cases, I can just cross that calf's legs and that provides enough twist on that calf as I'm pulling that thorax and abdomen through that pelvis will twist a little bit. If it's a really big calf, I may actually, use my forearm and put between the calf's legs and almost do a half Nelson and try to twist that calf a little bit more. But in most cases, just crossing the calf's legs as you pull and get a little bit of rotation on there and assist that. Very common cause of dystocia is a deviation of the head. Typically, that calf's head is turned back, and this was one. Again, it's pretty common. It's one that I don't spend a whole lot of time trying to fix, primarily because in a lot of cases, the reason that calf's head is deviated around is because that calf presented normally, but the calf is too big to fit into the pelvis, and after its head gets jammed against the pelvis too much, the calf will turn its head to get it out of the way, and then it gets pressed back along its body. So on a case of a deviation of a head, the first thing I'm going to do is check that calf's feet and determine and get some idea of whether or not this is a big calf or a small pelvis. If that's the case, then I may go straight to a C-section because you don't want to spend 45 minutes trying to get that head up and then find out that you're going to take another hour to try to get it out, and in which case we might have a dead calf. So trying to make that decision before you do something like that. But if it is just a small, if it is a calf that'll fit, then basically is what you want to do is you want to go back along that calf's side, get your hand under the jaw. May take two hands, one to try to repulse the calf's chest while you get your other hand back under that calf's head, and then try to gently rotate that calf's head around. You can use a noose and put around the calf's pole and down in its mouth and try to help pull that around if you can't get your arm back in there sufficiently. But generally, if you have some time, you can get most of these corrected. You just want to make sure that you can pull them once you make that. This is a typical presentation of a backwards calf. You can see that the legs, the claws are pointed and the dew claws are pointed up. So presentation of a backwards calf. Again, this is a calf that didn't present normally, didn't flip over in time. These are one of the biggest issues with this is once I start pulling on that calf, I'm going to pinch that calf's umbilical cord off as soon as I get that calf's pelvis up into the cow's pelvis. And so I need to be able to, once I start pulling past that, I need to pull fairly rapidly and make sure that I can actually pull that calf out. So again, I'm going to take some time, try to relax that soft tissue before I try to pull, because that calf hasn't been up in the cervix well, stimulating the the cow to relax, I'm going to use my arms to make her relax a little bit, so I can really pull this calf once I get going, because I don't have much time once that umbilical cord is pinched off before that calf is trying to breathe on its own, and I don't want it to trying to breathe when it's inside the cow. So you need to make that decision ahead of time of, yes, I can pull this calf out pretty fast once I get going here. Breech presentation, again, another case where the calf is born backwards, but in this case, both of those legs are tucked under. Typically, these cows don't move into stage 2 labor. A backwards calf should go into stage labor, stage 2, but a breech typically won't, because it never goes into the cervix. It never pushes up against that cervix and causes that second stage labor. So these are sometimes those ones where somebody says, I thought she was going to calve yesterday. Or you may see the tail. Sometimes the tail will be visible, is all that you see. But again, breech presentation are relatively fixable. It takes a little bit of time. Typically, we're going to try to repulse that calf by putting one hand on the calf's pelvis and pushing it forward, while your other hand is reaching down and cupping the leg. Basically, you need to get all the way down to the foot and flex that foot around and cup that foot so the foot doesn't tear the uterus as you're pulling it around, and then you can rotate that around that hip joint and get that through. If your arms aren't quite long enough to do that all at once, you can put a chain on that leg by passing the free end around the calf's stifle area, forming your loop. Once you get that formed, you can slide that down by the fetlock, try to pass the chain through the calf's claws, and again, that's going to help flex that foot around and decrease the chance of tearing the uterus. And then by pulling on the chain while you're repulsing the calf's hips, you can get enough room to get that leg around. Then you do the same thing on the other leg, and then you're in position to pull the calf as a backwards calf. Once that calf is born, we want to make sure that we provide some care, evaluate, make sure the calf is breathing. If it's not breathing, you can provide some inflate its lungs just by closing off one nostril and blowing down the other one. Try to inflate its lungs a little bit. There are some calf resuscitators you can buy as well, but either one of those can help to get those calf's lungs expanded, get some air down in there. Feel its heart. If it's doesn't have a heartbeat, you can provide some by gently pushing on that calf's chest. Try to provide some CPR to that calf. That may work and get that calf going. If it's had a difficult birth, it may need some supplemental oxygen. First thing we want to do is just stimulate that calf by rubbing its chest with a towel or some straw. We'll stimulate that calf to breathe. You may provide some supplemental oxygen. That can be, a specific oxygen tank that you have. Even if you don't have that, you typically have an acetylene welder. Just make sure the acetylene's turned off, and you can provide a little supplemental oxygen right into that calf's nose. Even for a couple minutes can help it transition well. And then get that calf warm and dry, let the cow nurse it, and make sure we get some colostrum in that calf, and we should be able to then provide that. So with that, happy to answer any questions you have, or Chris Clark is going to provide some more information on colostrum.
So my name is Chris Clark, and I will talk with you today just a little bit about management of the newborn calf. So our goal was for me to kind of pick up where Grant left off. We've got the calf on the ground now. We want to talk about next steps in calf management and calf care, maybe what we might do or not do for processing right there on that first day of life. So we'll kind of dive right in, and I first want to mention just a few little things about nutrition, and hopefully this ties in relatively well with what Grant already talked about and with our December webinar that we did about a month ago. And I think it's really important to emphasize the just balancing a ration and offering adequate nutrition to the pregnant cow. And there's lots of benefits that come along with offering adequate nutrition. I've tried to list a few of them here. It's not a complete list by any stretch. We could add some things to this, but I think when we feed that pregnant dam well, we can expect less dystocia, and remember, dystocia just means a difficult birth. We can expect better colostrum, better calf vigor, hopefully a shorter postpartum interval, and hopefully those females will be able to rebreed, more effectively. Like Grant mentioned, and I think like Katie mentioned in our December webinar, our goal is to really get those pregnant females to a body condition score of 5 or 6 at calving time. And for mature cows, probably a body condition score 5 is adequate. For first calf heifers, I'm probably shooting more for a 5.5 or a 6 at that first calving. So this is a slide of some data that Grant did show you, and I just want to reiterate a couple quick points from it. It's kind of showing heifer body condition score relative to calf performance. And the first parameter that I would point you to is the time to stand. And so in this study, as body condition score improves, the calves get up and stand more quickly. And that's kind of a big deal when we think about colostrum consumption, because really I want that calf to be up and suckling within an hour. And if you kind of look at those time frames, we've got a much better shot at accomplishing that if we've got the female at a body condition score of 5 to 6 at calving time. Like Grant mentioned, we have better colostrum production when our body condition score is good. And ultimately, between a better vigor and a shorter time to stand, and then more colostrum production by the dam, we end up with better antibody concentration in the serum of the calf. And so that can kind of be seen there in both the IgG and the IgM levels. So again, just to kind of reiterate, Grant did show this one as well, but this one shows the effect of prepartum energy levels on several different parameters. And again, this is one where they shorted the cows on energy throughout the last 100 days of gestation. And then in the group that you see on your right, they went ahead and boosted the energy level in those diets the last 30 days. And just by increasing energy level in the last 30 days of gestation, we see some big differences just in terms of calf birth weight, calf survival. We had fewer scours treated and fewer scours deaths or fewer mortalities from scours, and then better weaning weights as well when we fed greater energy just in those last 30 days. So to me, that kind of speaks to the importance of providing adequate energy. So we do sometimes get a question about the impact of that energy level, and sometimes the impact of protein level as well on subsequent birth weights and how that might contribute to dystocia. And so this is a set of data from the U.S. Meat Animal Research Center in Nebraska. And it kind of shows us that just because we feed a higher energy diet doesn't necessarily mean that we can expect more dystocia. So the blue lines, or the blue bars, represent birth weight. The red bars represent calving difficulty. And we're basically looking at 3 different diets here. So we're looking at low, medium, and high energy diets. And in this data, you can kind of see that as we feed higher energy diets, we do see a slight increase in calf birth weight, but we actually see less dystocia. And so one potential explanation for that is just that the calving process requires a fair amount of stamina, strength, and energy. And I think there's the possibility that when we don't offer adequate energy to those cows, they just aren't able to go through that process as effectively. So this is some data from the USDA NAHMS survey. NAHMS is the National Animal Health Monitoring System. And this goes back to the 2007-2008 cow-calf survey. And basically, there was a set of questions that asked producers about calf morbidity and calf mortality, trying to get at some causes of death. And producers indicated that of those calves that are born alive but die prior to 3 weeks of age, almost 26% died from calving-related problems. Almost 26% died from weather-related problems. Almost 19% died of unknown causes. And then 14% of gastrointestinal disease, 8.2% of respiratory disease, and 6.2% of injury or predation. Now, when I look at this data, I would honestly guess that some of the unknown causes of death and some of the infectious diseases and injuries ultimately go back to calving and weather-related problems. And so when I think about that, if my hunch is at all right, and if these numbers are at all correct, if we can protect those calves from weather extremes, and if we can manage the birthing process really well, we should be able to save a tremendous number of those calves. And then I would add to that, when we're thinking about infectious disease, if we add just a little biosecurity to the equation, and we try to make sure that those calves really do get a good, healthy dose of colostrum, we should save an even greater number of those calves. So when it comes to managing that newborn calf, my instinct has always been that sometimes less is more, and sometimes we need to let Mother Nature kind of take its course, allow some bonding, allow the calf to get up and suckle and nurse. And so kind of between that instinct of mine and between the data that I just showed you from the NOM survey, my focus tends to be on these 4 points kind of above that line. And those points I'm highlighting in red now, but really we want to minimize dystocia, protect the cattle from weather extremes, make sure we get adequate colostrum into those newborns, and then implement some biosecurity to kind of protect from various infectious diseases and pathogens. So that tends to be where I focus my energy. We do have some kind of optional things listed down below. So we may, in some cases, want to dip navels. We may want to tag or identify calves. We may want to castrate, dehorn, offer some other injections and things at birth. But I consider those somewhat optional, and we'll kind of go through those just briefly here in a little bit. So I do want to talk about colostrum in a little more depth, and I think it's important to kind of think about the fact that calves are born almost completely lacking antibodies for protection. The bovine doesn't really transfer antibodies well across the placenta, so the calves are born almost completely vulnerable without antibody, and really they can only get those antibodies through ingestion of colostrum. We call that process passive transfer of immunity, and that's a really important thing to get the calf off to a good start. Inadequate colostrum, or what we sometimes call failure of passive transfer, can have some negative consequences. And often that's greater morbidity, which is just sickness or illness, and greater mortality, which is greater death loss. And usually we think about that mostly in the first 2 to 3 months of life or so, because hopefully after that, the calf's starting to create its own antibodies and mounting its own immune response. But there is evidence that failure of passive transfer can actually cause some pretty long-term impacts on health and performance as well, sometimes clear through later phases of production. So this graph shows some data from the USDA National Dairy Heifer Evaluation Project, and this is back from the early 90s. But the upper, heavier, darker line that I'm highlighting here, that describes the calves that received enough colostrum to get at least 1,000 milligrams per deciliter of IgG in their serum. That would have been tested probably at approximately 24 hours of age. And then the lighter line below that kind of represents those calves that did not get adequate colostrum, and their antibody concentration would have been less than 1,000 milligrams per deciliter at 24 hours of age. And basically here we're just looking at calf survival relative to day of age and relative to antibody concentration. And we see greater survival in those calves that had adequate colostrum. Almost twice the death loss basically in those that failed to get adequate colostrum. Just pointing out here a few points from another study that calves with failure of passive transfer had increased risk of neonatal morbidity and pre-weaning morbidity and mortality. They also had greater risk of morbidity and specifically respiratory tract morbidity in the feedlot. So that's later through the next phase of production. And then they also had reduced performance, basically lesser average daily gain. That's thought to be kind of a secondary effect of the illness, and those calves probably get set back, don't eat as well for a period of time. So we do see some production or performance effects there as well. So when I think about colostrum, we always think about IgG first, and we talk an awful lot about passive transfer of immunity, and we talk a lot about measuring IgG levels as kind of a marker of colostrum ingestion. But there are a lot of other compounds and components of colostrum that are really, really important for the calf. And so I tried to demonstrate here, IgG is really, in my mind, kind of the tip of the iceberg, and we've got other antibodies present in colostrum. You've got nutritional components like carbohydrates, proteins, fats, some vitamins and minerals like Grant mentioned earlier, plus a whole bunch of just unique compounds like enzymes, growth factors, enzyme inhibitors, things we call cytokines, which are kind of chemical messengers that help the different cells communicate within the immune system. And there's also a fair number of cells, including white blood cells in the colostrum. And so when you add all that up, there's a lot more to colostrum than just IgG. And I think that kind of reiterates the importance of making sure that we do get good colostrum consumption by our newborns. So what does that look like? We really should try to get about 6 to 10% of body weight of colostrum into that calf within the first 24 hours of life. Practically speaking, that usually comes to about 2 quarts or so, hopefully within the first 4 hours, and then hopefully another 2 quarts or so by about 12 hours of age. And we have to remember that time is kind of the essence here. And the gut closes or basically stops absorbing antibodies by about 24 hours of age. And there's actually a pretty significant and progressive decline in the uptake of antibodies. And even by 12 hours of age or so, we could lose up to 25 or even 50% of our total absorptive capacity. And so really the sooner the better when it comes to colostrum consumption. So I found this study that I thought was kind of interesting. And in this study, they looked at the failure or success of calves to consume colostrum by 4 hours of age. And they found that those calves that failed to consume colostrum by 4 hours of age had lower IgG levels, they had a lower odds of acquiring the optimum passive immunity, they had a greater odds of being treated for various different infectious diseases than those that did nurse or get colostrum by 4 hours of age. Infectious diseases here included gastroenteritis or scours, I think a few respiratory cases, a navel ill case, I think maybe a foot rot case. So kind of just various different infectious diseases. And the graphs just kind of show that same thing in more of a visual way. The bottom graph here shows that those calves that failed to consume colostrum by 4 hours of age were more likely to be treated. And then the upper graph shows that those that failed to get colostrum by 4 hours were less likely to have adequate passive immunity. So Grant kind of walked us through the stages of labor and some pointers on assisting and kind of managing dystocia. I think dystocia is a pretty big risk factor for failure of passive transfer. And that can be for a variety of different reasons. I think anytime you have a dystocia case, you need to kind of take a step back once you get that calf delivered and just evaluate both cow and calf. Are they stressed? Are they tired? For the calf, does he have a swollen tongue, a swollen head? Is he able to suckle? And for the cow, is she able to stand? Does she have adequate colostrum? And is she willing to let the calf nurse? And so all of that kind of has to happen, right, for the calf to get adequate colostrum. Now, if there are issues, and we do have to intervene, I think it's important to remember that mother's milk is almost always the best. You know, from what I described about all the different components of colostrum, I think it becomes pretty difficult to completely replicate that in a commercial product. And so we like to offer mother's milk. So if we have various other problems, but colostrum production is adequate, we probably want to milk her out and go ahead and offer that with a tube, like an esophageal feeder or a bottle, and let the calf suck. Now, if we don't have adequate mother's milk available, we can do fresh or frozen colostrum from another cow. And this is sometimes challenging depending on who else is calved and where you're at in the calving season, but I would prefer colostrum from a mature, healthy, well-vaccinated cow within the same herd. So I get concerned about biosecurity risk if we start sourcing colostrum from other herds and other sources. And I think it's pretty well accepted that mature cows have more quantity and quality. colostrum than heifers. And so this would be a kind of a guideline if we are trying to get colostrum from another female. We do have commercial products available. If we don't have access to colostrum, whether it be fresh or frozen, there are various commercial products, both supplements and replacements. And I think it's worth kind of noting the difference between the two. The name kind of says it all, but supplements are meant to supplement some natural mother's milk, some natural maternal colostrum. And they're going to have less IgG per dose, and they're going to lack some of those nutritional components as opposed to a replacement. And replacements are meant to be used, kind of as a true replacement in the complete absence of maternal colostrum. And they're going to have typically greater than 100 grams of IgG per dose, often up to 150 or 200 grams of IgG per dose. And they'll often contain some of those nutritional components as well. So some fat, some energy, some protein, some of those other things that really we need to get from that colostrum. There is a price difference. But I think in my mind, if you really just need a supplement and you go ahead and offer a replacer, there's probably no harm done other than the additional cost. The opposite is not true. If you really need a replacer and you offer just supplement, we're going to be shorting that calf of several different things. I usually mention here we do want to use products that are licensed by the USDA, and we do want to be sure and follow label directions. And really for everything that Grant and I are talking about tonight, I encourage folks to talk with their regular veterinarian about these topics. It's important to establish a good relationship, a nice working relationship with your vet, and use them as a resource and kind of get their guidance and their help on these topics as well. So the next topic here that I want to address is biosecurity, and I want to spend just a few minutes kind of talking through that. Basically, we're thinking about how do we limit calf exposure to infectious organisms. And there's a couple different ways to think about biosecurity. The first thing I always mention is that in my mind, it really comes down to awareness and cleanliness. And that maybe seems oversimplified, but when you think about it, that's really what it is. We need to kind of think through potential risk, and then often what can we do in terms of cleaning and disinfection to manage that risk. And the next little section there, the next bullet point, kind of talks through big picture biosecurity things where we're trying to protect from outside sources of infection. So this would apply to calving season as well as the rest of the year, right? But we want to limit visitors. Maybe we want to limit new animals into the herd. If we do acquire new animals, we want to quarantine them hopefully for a month or so before mixing them with our existing herd. Maintain fences, control vectors. So vectors are living things that can cause disease or can transmit disease. So there I'm thinking usually about rodents and insects. And then we want to think about it and try to clean potential fomites. Fomites are inanimate or non-living things that can become contaminated and spread disease. And so with fomites, I'm often thinking about things like boots, tires, coveralls, veterinary equipment, things that can become contaminated and spread just mechanically organisms from one farm to another. But I think when it comes to calving season, there's some other ways to think about biosecurity. And it may be just that we want to think about how to protect those vulnerable newborns from organisms that are more ubiquitous on the farm and maybe already present in some of our other animals on the farm. And so we kind of go through here a few important points. And the first one is just to maintain a clean, dry, well-bedded calving area. And then I bring that up for several different reasons. The first is to manage pathogen load. So I think anytime we have a wet environment with a lot of manure and urine and organic material, it's a really good environment for organisms to survive and thrive. And the better that we can clean and disinfect and remove organic material, the better control we have over pathogen load and just trying to minimize that pathogen exposure as much as possible. The other reason I mentioned clean and dry has to do with calf immunity. So I was taught in veterinary school that cold temperatures can suppress the immune system to some extent. Cold and wet conditions on top of one another can suppress the immune system quite a lot. And so these newborn calves, when they get cold and chilled and they're wet in addition, it's just that much more stress on their immune system. And then finally, I'm thinking a little bit about teat condition. And I really want to keep the teats clean because when calves do latch on to suckle, I want them to ingest colostrum and milk as opposed to manure, right? And so those are three big reasons just to work at maintaining that good calving environment. So I've got this picture up here. It's kind of the same one that Grant showed earlier. It looks nice and pretty with clean, fresh bedding. I know that's not always easy to accomplish. Those of us that are viewing from Iowa know what it's doing outside right now. So Mother Nature doesn't always cooperate. But that's kind of what we want to strive for, clean and dry with a nice fresh layer of bedding. The next point here is just about cleaning and disinfecting facilities and equipment, and that's whatever you're using, calving pins, chains, calf pullers, esophageal feeders. I've seen those get pretty gross if we don't clean and let them get dry as well. And so we want to make sure that we're not introducing bacteria and mold and things like that when we're actually trying to supplement with good products. A few final points here on biosecurity. You know, I think one thing you can do is pay attention to the order of care or the order of chores in a day. And so maybe you want to chore and care for your sick animals last rather than first so that we don't transmit those organisms to the healthy cattle. Maybe if you've got a set of really vulnerable newborns, you want to take care of them first in a day as opposed to last. So you can kind of think through those types of things. The other thing you might do is think about decreasing density of the calving area. So often we'll talk about, in the case of an outbreak, we want to maybe move from, as opposed to a dry lot setting or calving under roof, we want to move out to a pasture, a stock field, cover crop field, something like that, where we can spread out the animals, we can kind of decrease the concentration of animals and pathogens. I realize calving season is a big part of that, right? Sometimes, you know, in January, February, for instance, it may not be good to be out on a big open field when the blizzard comes in. Same kind of struggles in April when it's really raining and it's really wet and muddy. But I think it's important to kind of just pay attention to the weather. If it does happen to be unusually dry or unusually warm, maybe you can kind of kick them out for a while, let them spread out, have some clean, dry environment. Be prepared to kind of watch the forecast and gather and pull them back in if you have to. And finally, I think it's important to talk just briefly about the Sandhills calving system. And that's a system where you move pregnant cows away from the remaining pairs about every week or so. And at least in my experience, the typical calving flow often looks something like this. And so you've got your winter feeding area, maybe a sacrifice paddock from a pasture or a dry lot. And we've got some type of centralized calving area. And that works well for us in terms of convenience because we can set it up with our equipment and our medicines, and we can kind of have everything ready like Grant described. And then ultimately we want to get them on the ground and hopefully kicked out to pasture as soon as possible, right? The problem with that is that sometimes that calving area can become contaminated. And if it turns into a feeding area for pairs as well as a calving area, those older calves may start to shed organisms, contaminate the environment, and now every young calf that comes through there gets exposed. And particularly if you're calving early in the season, and so you may not have pasture ready for a while, so you're holding on to pairs before turnout, or if just your schedule and conditions dictate that you get behind in turning pairs out, that can be somewhat of a problem. So the Sandhills system was developed in the Sandhills of Nebraska, and it goes on the premise that we want to move remaining pregnant cows every week or so and basically start them over in a clean, non-contaminated calving area. And you leave the pairs behind, so it's a little counterintuitive as to how we might usually manage those animals. Essentially, we start over every week with a new calving area, kind of new calving season, and then hopefully, by the time we're done, we've segregated calves by age, so those vulnerable newborns are protected from pathogens that might be shed by the older calves. So this is just a schematic of what it might look like if you have, 4 pasture paddocks here and we're 2 weeks into the calving season. And so the current calving area would be where we're calving right now. 1-week-old pairs are back here, 2-week-old pairs are back here. And then our next move in a week would be to move the remaining pregnant animals to this brand new calving pasture or calving lot. Now that sounds wonderful, but logistically it can be challenging, right? Depending on your available resources, your land base, how many pastures or lots you have available, it just may be hard to accomplish. But I think you can do modifications to this and use the Sandhills principles. Maybe that means just having a backup plan. So we've got our main calving area, but one backup area. And if we do experience an outbreak, we immediately make a move. And we move all our remaining pregnant animals to a new place and we kind of start over. Maybe it means 2, 3, or 4 calving areas instead of 7, 8, or 9. Grant described that a calving window might be 60 days or longer. So let's say we've got a 63-day calving window. If we're actually moving remaining pregnant females every single week, we need 9 different calving pastures, right? That's a lot. But if we can, maybe we can accomplish 2, 3, or 4, and we're moving less frequently. Maybe we can find a way to move every 2 or 3 weeks as opposed to every week. I think we can still use those principles to make a lot of progress. Finally, just some points here on those kind of optional things that I listed on that earlier slide. The first one here I've listed is dipping the navel. This can help to prevent navel ill or umbilical infections. When you think about that newborn calf, that's kind of a vulnerable spot where infection can easily ascend through that open umbilicus. So sometimes we'll dip in iodine, chlorhexidine, or other commercial products. Traditionally, we'd use like a 7% tincture of iodine. So it's a more concentrated iodine and it's got some alcohol in it to kind of help dry out the umbilical stump. Or you could use like a surgical scrub kind of iodine that's a 7% or so concentration. That's a little harder to get these days than it used to be. And so sometimes we'll go toward the chlorhexidine or towards non-iodine commercial products. I often remind people, though, I think it's important to stop and think about why you're having to dip navels if you become kind of dependent on that procedure. Now, I totally understand if you get into a tough season, weather hasn't cooperated, we've had a few infections, and we need to do it to get through this next however many weeks or months. But if it becomes routine that we really have to depend on dipping navels to prevent umbilical infections, I think we have to stop and think about our overall system, our hygiene, our cleanliness, our biosecurity. And I think if we're doing a really good job with those things, we shouldn't really have to dip navels routinely. I did list castration and dehorning here. I think those should be done at a young age, but not necessarily on day one. I think in the industry, we're really doing a better job all the time of trying to be conscious of welfare and stress and trying to do these things as low stress as possible. And we see a little more emphasis all the time on analgesia, which is pain control medicine, and then on anesthetics, and probably mostly local anesthetics. General anesthesia may not be feasible or appropriate for these procedures all the time, but certainly there are some nerve blocks and some local anesthetic techniques that can really be helpful. I would say most of the time I'd like to see these procedures completed by the age of maybe 2 or 3 months old. Again, not necessarily on day one, but certainly some people go ahead and band or disbud or whatever right away, and that's okay. I think when it comes to dehorning, my usual argument is that these days it's pretty easy to dehorn genetically, and that would be my preference. If you can find bulls that are homozygous polled, regardless of what your cow genetics look like, you should have polled calves. And I would try to use that tool as much as possible. So Grant talked a little bit about weak calf syndrome and some nutritional things. And, I kind of mentioned vitamin A, D, and E shots here, and we could also add on to this, vitamin E selenium shots and vitamin B and B complex shots and things like that. And I think those shots can be helpful, again, if we have specific deficiencies, if we've had a tough year and we know we're dealing with low quality forage. If we really think we're at risk for weak calf syndrome, I think some of those shots can make some sense. Again, I don't know that I would always do it just routinely to quote unquote get the calf off to a good start. There may be a few products out there that have shown some benefit, even in the face of normal circumstances and normal nutrition. But big picture, I encourage people to step back and think about the gestational nutrition of the dam. If we can do a really good job of feeding the dam well, we really shouldn't need a lot of vitamin injections. I mentioned tagging here. I sometimes have to kind of stop and think, how necessary is it to tag on day one? Most folks tell me if they don't get it done on day one, by day 2 and 3, you can't catch it, right? But I think it's important to just stop and think about how you use that. I don't want anybody getting hurt and getting run over and stuff just to put a tag in, especially if it's not really being used effectively. And then finally, I've got just a couple points here about vaccination. And in my mind, the neonatal period is just not a great time to vaccinate. And some people like to go ahead and do a blackleg shot or, a 7-way clostridial, pink eye shot or whatever at birth. But even those, I think, could be more effective if they're given a bit later. And so I think when we think about neonatal immunology, there's several different points to think about. So the first one is maternal antibodies. Now, I told you calves are born pretty much without antibodies. But then if we do get adequate colostrum consumption, they should have kind of a whopping dose of maternal antibody as passive immunity. Those maternal antibodies should probably interfere, or will probably interfere some with efficacy of a vaccine that we try to give at birth. Okay, they're trying to fight off the antigens that we're trying to administer. But beyond that, I think about cortisol. And physiologically, one of the major steps that kind of cause the birthing process to start is release of cortisol from the fetus. Cortisol is known to be a stress hormone that suppresses the immune system. And that calf's going to have elevated cortisol levels for probably a week after he's born. So again, that's going to probably inhibit the effectiveness of a vaccine that we try to give. There's also numerous other hormones and cytokines that kind of modulate or suppress the immune system a little bit. And in this box here, I've kind of tried to describe, I adapted this from a paper by Chris Chase, who's a veterinarian from South Dakota State University, and he's got a nice article about neonatal immune development and kind of how that relates to vaccination. And I modified some of that information to put in this box, but when you think about the immune status of a calf, it's just really not a great time to expect a good response from a vaccine. This is kind of a nice picture kind of demonstrating some of what's happening there. And the very first part here represents gestation, and we can kind of maybe skip over that right now. And we'll start here right at birth. The black area here under this curve represents passive immunity. So that's maternal antibody from the colostrum. And then the active immunity is represented along this line here, and it's hopefully growing as time goes by. What happens, though, is sometimes you get this window of susceptibility where passive immunity is on the decline, active immunity is on the incline, but we get this little window where we don't have quite enough of either one. That, to me, reiterates the importance of colostrum, because if we can imagine starting out with a lesser dose of colostrum, a lesser level of passive immunity, it's going to dwindle and decline that much more quickly, and it's going to make us have a larger or wider window of susceptibility. The other thing that's interesting about this graph is look at the big arrow down below, where we're kind of describing when calves become fully responsive to a vaccine. And I think the reason they've got it kind of grayed out here at the beginning of that arrow is that it's a little bit iffy. It's a little unknown as to exactly when that calf becomes completely responsive. But notice the arrow is not starting there right at birth. Calves are born with all the major parts of the immune system ready to go, but it really just takes some time for them to mature and develop and for all of those parts to start working together and doing what they're supposed to do. So I felt like I went through that pretty quickly, but this slide kind of, in summary, just lists my keys to success. When I think about managing the neonatal calf, I focus first on nutrition of the pregnant dam. I want to think about minimizing dystocia as much as possible, protecting from weather extremes, And then I really focus on colostrum and biosecurity. And hopefully, if we do all those things well, we can get them off to a really good start. So with that, hopefully Beth will help me here and we can see if we've got any questions coming in.